This video is to demonstrate the movements and control of the thyroid uptake probe. The two control arms have two pivot points and two rotational points. The gantry control arm has a lock and an unlock position. In the unlock position, you have free movement of the arm up and down. In the locked position, it will not go down, but if you need to get it out of the way of the patient, you can slide it up. Once you reach the top, it will still not go down until you completely unlock the device. Next pivot arm simply rotates the collimator head so you can position it for your patients. We also have a rotational joint here on this button. This button should not require any pressure to push down. If it does, you need to take some of the torque off the head. It will rotate 90 degrees and lock. If you push it down again, it will rotate another 90 degrees and also lock in position. The final movement on the collimator is also a lock and an unlock position. I do not recommend that you freely spin this. I recommend you just loosen it a hair. The collimator head will rotate through a little over 180 degrees. So you can position it for your different patients. The last thing I want to talk about is your distance bar, as well as the LED positioning light. These you can use when you set your patient in place. Your distance bar generally is around 25 centimeters. You check with your physician to see what distance they want. Your LED light is strictly to position it in the center of the thyroid. I do strongly recommend that when you acquire your data, you turn the light off and make sure the positioning bar is out of the way, as they will attenuate counts. You're going to demonstrate how to do a thyroid uptake on a patient that is seated. You're going to lock the collimator control arm and extend the arm to the patient. We do recommend that the handles are in the 12 o'clock and 6 o'clock position, keeping the distance bar on the sternal notch. You can activate the red LED positioning light and bring it into the patient. Make sure you lock the collimator control arm bar down as well, and turn off the red LED light, making sure that the distance bar is out of the way, as they will attenuate counts. Okay, we're going to demonstrate how to do a patient that's in the supine position. You would have already given your dose and the patient would have come back in 4 to 6 hours or 24 hours, depending on your hospital protocol. Recommend the device always be in unlocked position, because you'll be able to move the collimator control arm up and down effortlessly. As you extend it out over the patient, you can engage the red LED positioning light onto the sternal notch until the distance bar touches the patient's throat. Please be certain to make sure that the distance bar as well as the red light are retracted for the procedures, as they will attenuate counts. We're here to talk about counting your standard using the neck phantom on your Atomlab 960 software. One of the features of the Atomlab 960 is that you can now store your thyroid neck phantom on the shelf here. It's locked in by these rubber points. If you've ever dropped it, you know they don't fare very well. Recommend opening the collimator control arm into the unlocked position so you can adjust its height. Swinging the apparatus for the two arms out. Adjusting your collimator so it's in the horizontal position. It's important to have the arms in the 3 o'clock and the 9 o'clock position, or else you will be unable to rotate the collimator into the position on the thyroid neck phantom. You also have the opportunity now to use your LED positioning light. So you may swing the arm around and center the LED positioning light onto the crosshairs of your phantom Keeping in mind you want your distance bar also the same to keep your geometry the same. Also be certain to turn off the LED positioning light and make sure that the distance bar is not in the field of view, as it will attenuate counts.